I have learned in my career of doing this that drug discovery and drug development is one of the most challenging, difficult, arduous, and rewarding pursuits that human beings can engage in. It requires an enormous collective effort of supreme intellectual achievement. And I think when many people think about drug development, they think of it as science. And when they think of science, they think, well, this is very analytical. This is numbers and number crunching and working with computers and beakers and data and tons of data. And they're right, it is. What often gets lost is just how much creativity is required to discover and develop medications. And without creativity, there is no drug discovery and drug development, just as without data, there is none. These are antibodies. Antibodies are coded for by the genome, the familiar ATCG genetic code that we now know. That code was decoded by our ability to use this kind of code, binary code, software code. A tremendous human achievement, melding in the most creative way one can imagine apparently disparate disciplines and bringing them together to enable enormous, fundamental acts of creativity that enable us to better the human condition. Such explosive creativity, in fact, that what I've discovered in my own organization is that we need new ways of enabling our organizations and the people in them to take full advantage of these interfaces between data and creativity.
I think that the industry, but also the agencies, still don't know enough about the patient life. And sometimes when you look at the sheets, you're a little shocked how little influence you have with your website and with your issues. And I think they really have to dig deeper. But when you think about a company and you have a one-year plan, where you have to reach a certain goal, and that's how many people still think in boxes, even half-year plans. And this is not going to work. And that is something where everybody has to rethink about the business model itself. Because, I mean, what you expect, you have a great idea, and normally in the old days you would just roll it out, and then you would be a little confused that the patient organizations are not so excited about your $1 million program. So now you learn something, Now you're gonna go to the patient organization and you talk to them. But now you're surprised that they're not really happy to meet you because you haven't talked to them for the last 5 or 10 years. So that is something you have to learn. It's really sometimes that I go to my colleagues and say, don't take it personally. I mean, just look at the other side. The main thing we have to do, and that is really the investment we have to do, is the famous trust building. But trust building is not going to work if we meet with a patient organization 1 or 2 times a year. That is not trust building. How you want to build trust like that? And that is, of course, where my role jumps in as patient relation manager, but I cannot build the trust on my own. I always have to have the backup and the promise in a way from my company to say, if we really want to be patient-centric, that means a real long-term commitment. And when we have done that, then the second step comes, and the second step is, what can be our role? Because as you said, the patients are already out there. So what can be our specific role? And then what can be our topics? And that is something that's 1, 2, 3 steps. And that is, and I think it's also a problem for agencies, because you go to a customer and tell them, oh, that's a great idea what you want to do in that field. I suggest you make a 10-year-long plan. And that, I think, is the issues where the industry is still not there, where what the needs are outside in the patient world. So everyone has to learn.
When we were looking at how to shape the post-2015 agenda for women and children, we concluded that one of the easiest ways to do it, and where the need was highest, was in birth preparedness. And actually, with McCann Health and with the United Nations Foundation and the Norwegian government, we took this tri-sector approach, because we also have to build these programs around sustainability and build programs that can go to scale and be self-sustaining, so that the commercial element has to be very, very strong, you know, from the commercial operators. And I found it very important while putting together partners to ask people to do for good and for development and for impact what they normally do anyway for their businesses. So for instance, as a pregnant woman, you should save to have your baby. I'm putting together birth preparedness savings accounts. And when I was looking, okay, who will be a good partner for birth preparedness savings accounts, I looked immediately back to our original partner for community health insurance, because everybody said it couldn't be done at that time, 7 years ago. An insurance program that the capacitation from the patient is $2.80, and it covers pregnancy and it gives you a full costed package of care. And they immediately said, well, actually, this is what we do, inclusive financing, because as you have said, we can no longer completely separate health in a silo by itself. You know, to conquer poverty and to guarantee access, we have to begin to look at things in a holistic way, the way that life is and the way that life presents itself. And as you say, you put the person first, and you put respect, you put kindness, you put dignity. When people are secure in themselves, when they have a roof over their head, when they are educated or they have access to education, when they have enough training for a vocation or business or profession that they can use to better their own lives, when they have safety and security, they themselves can drive their development because their ambitions rise.
At Novartis, our purpose is about caring and curing. And you know, in 2012, we touched about 1.2 billion consumers and patients, but not all those 1.2 billion consumers are the same. You've probably seen this pyramid, right? A consumer pyramid that segments consumers based on how much money they have to spend per day or to live on per day. And if you take a look at the bottom three, there's about 4 billion consumers in there that live on less than $5 a day. If you look at the ones in the bottom, it's a lot less than that. You know, so to me, the approach that we take is a little bit different based on who it is we're trying to connect with. At the top of the pyramid, it's business as usual. You know, this is where the mainstream of the business really focuses on. When you take a look at the bottom rung, that is very much focused on philanthropy. Because when you make that little and you live on that little a day, it's not really a choice. You don't really have an option. But it's those two in the middle, those two segments, where we can do some pretty interesting things. And if you go look at the second from the bottom, our focus there is a lot more on zero profit. And I'll share with you an example coming up here on what that could look like. And the one above that is where it gets even more interesting. It's about shared value. And that's about social business. It's about creating an entire system that can be sustainable. And if you focus on those two, what we found out is those programs and those activities are actually sustainable because they don't depend on somebody feeling generous to write a check. Regardless of how the business goes, this moves on because this is also business.